MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Connecting Marylanders to their government. This is State Circle.
Good evening. Welcome to State Circle. We begin with the latest coronavirus reports from Maryland. The total number of confirmed cases is up to 774, with 5 fatalities as of our taping time. Maryland has received a federal major disaster declaration opening the door to emergency reimbursement. Public schools in the state will now remain closed through April 24th. Child care facilities are limited to the children of essential workers. Full details and official resources can be found at coronavirus.maryland.gov. The U.S. Senate has passed a $2 trillion emergency aid package. Maryland Senator Ben Cardin among those in favor. Senator, thanks for being with us. Let's start with the most important parts of this legislation that you just passed in the Senate. What does it mean for Marylanders?
Well, first, let me give you the size. This is a $2 trillion package. That's equal to a full year of discretionary spending at the national level for both military and non-military. So it's going to have a tremendous impact on our economy. We have a lot of federal workers. This is going to provide the wherewithal so federal workers can get their income. Federal contractors can get their workers paid. There's a lot in here that's going to help our economy. Directly from Maryland, the governor will get over $2 billion in stabilization funds. Some of that will go directly to our large counties or municipalities. Baltimore City will get about $1 billion. About $100 million, on stabilization money. Baltimore County will get a little bit more than $100 million. That will be coming in very shortly. They have to apply for it, but obviously they can demonstrate that need. Our hospitals will be eligible to receive money under a program of $100 billion of federal assistance, recognizing that we're asking them to keep rooms open for the need that we expect is coming. We also have an additional payment to our hospitals for coronavirus victims, those who are being treated in the hospital, and Maryland will be able to qualify, although we normally don't qualify for federal payment rates because we have our own system. Our schools will get monies directly. There's about a $13 billion national pool that goes to our states, 90% of which goes directly back to our education agencies, so it'll go directly to Baltimore City, Baltimore County, and all the counties, and that will help them in regards to the cost of schools. The most important part is the health issues. There's funds in here for the testing, there's funds in here for protective gear, there's funds in here to accelerate the vaccine developments, therapeutic drugs. This is a program for what we call a Marshall Plan for healthcare, and to get our economy back on track. I'm particularly pleased about the small business provisions because I helped craft them. Many Maryland small businesses cannot survive without some federal help. This bill can provide 8 weeks of payroll plus other expenses for our small businesses.
You mentioned the federal workforce. Among your constituents are so many federal workers who are going to be tasked with making all of this happen when so many are unable to go to work at the moment, working from home. How do you expect the logistics of this to work? And I'm thinking of the stimulus checks that go to individuals.
Well, Jeff, very good point. Our federal workforce, we have encouraged our agency heads to set up flexible arrangements for telecommuting. We don't want to see people go into buildings. So we are urging that type of activity. For those businesses that have contracts with the federal government, this bill provides for their workers to be paid even if they can't get on site. We want to make sure that those checks continue. In regards to the IRS checks that'll be coming out to every person in this country, every taxpayer, Social Security recipient will be receiving $1,200 per person plus $500 per child. That will be electronically delivered if you have an arrangement with the IRS for electronic transfers, so or Social Security for electronic transfers. So we want to get this money out in your hands without you having to go out to get it, and so that you can take care of your needs.
Anything in this bill that you wish wasn't there, and were there some things that you and other Democrats would have preferred to get into the legislation?
Well, absolutely. This is a compromise. First, as you know, Senator McConnell released a bill, I guess, about a week ago. We did not think that was adequate. We're very pleased that we were able to add the state and local money to the original package that was not included in Senator McConnell's bill. We also were able to get additional monies in for healthcare, for businesses, for protecting workers. The unemployment insurance was not in the original bill. This provides unemployment insurance for everyone who is affected by the coronavirus, including self-employed in the gig economy. We also have a relief for nonprofits in this bill. So I'm very pleased by the scope of this legislation. Are there other issues I wish were handled better? Well, at one point, the District of Columbia was not treated as favorably as I think they should have been treated. So yes, I would have liked to see better protection there. There are, I'm sure, gaps that we are going to have to fill. That's why we're looking at what we call COVID-19 4, which will be the fourth stimulus package, and we're already starting to work on that.
You've been through in your political life all sorts of different crisis situations. Obviously this is different than at least anything I can remember. On a personal level, how's it affecting your life? How's it affecting your family, your constituents, and the government of the United States?
Well, this is unprecedented. None of us have ever gone through anything like this. So this is new territory for all of us. And the just uncertainty out there is something that bothers everyone. It's something we have to deal with. We have family members who are deciding whether they can go ahead with plans for marriages. We don't see our children or grandchildren except through Skype. It is very concerning to all. You asked how we're dealing with it. I'm doing what I hope every Marylander is doing and every American is doing. I am home. I work from home. I'm on my phone with teleconferences just about all day. Yesterday, I was able to get through to many federal agencies to help the governor with his declaration so Maryland can get funds under the Stafford Act. We also were on the phone with the State Department because we have stranded Marylanders in other countries we're trying to get home. So it's a full day. It's a full day at our home so that we can all contribute to slowing down and hopefully ending this disease.
Well, I'll tell you, I've been working from home, doing live broadcasts from home. The commute is terrific. There's no traffic whatsoever, but I miss seeing people. It's a different way of working, and I don't know. At the end of this, whenever it is, you wonder how the world is going to change. Are we ever going to shake hands with people, give somebody a hug?
Well, you're right. I'm sure that this will change social behavior. There's no question about it. But we do hope that we can get back to our normal activities. I think that's going to be very important. I had to go in and vote this week. I thought we should have done it remotely, but Leader McConnell decided that we had to physically be there. So I went to Washington, a commute that would normally take me during rush hour 2 hours. Got there in 50 minutes. I kept my distance from people, which is what we're asked to do. But I think going forward, when this crisis is over, we all need to practice good public health. But we need to understand that we are social people and we need to get back together again.
Senator, we appreciate the time. Be safe. Thank you very much.
Thank you, Jeff. The same to you and to all the viewers. Stay safe. Let's get through this together. Listen to what the governor is saying. This is we're united in Maryland in our efforts to put the public health of Marylanders first.
When State Circle continues, how communities around the state are responding.
Can you tell us what you know?
Turning back now to the race for the White House. The State Board of Elections voted Thursday to set up a new election.
It must be a very emotional day.
The world changed in the blink of an eye.
Children are at the heart of this story.
The Maryland Health Benefit Exchange is adding a special open enrollment period. Joining us by Zoom is Michelle Everett, who is Executive Director of the Exchange. Michelle, thanks for, and who is this for?
Hi, Jeff. Well, thanks for taking time to have me on today. This special open enrollment period, which is 30 days, it started March 16th and will go through April 15th. And it essentially acts as if we were an open enrollment in the fall. So anyone who does not have health insurance today can come and enroll and see if they qualify for free or low-cost insurance. But most importantly, we want people to come in and get coverage if they're able to get that coverage.
What should people know about the process, when the coverage would take effect, that sort of thing?
The coverage will take effect for everyone, no matter when they enroll during this period on April 1st. And they should go to marylandhealthconnection.gov and sign up through there. They can call our call center as well. We have all of our navigators. Our navigators are working remotely, so they can call and get an appointment for a phone call. But the best way is to go to marylandhealthconnection.gov, and all the information is there. It's very easy. We've actually had over 5,000 people already enroll, which is terrific.
How many people do you think are without health coverage in Maryland right now?
When we did our last study, of course, we have 94% of Marylanders do have insurance. 6% remain without insurance, and that equates to about 400,000 people. Of that, we figure roughly about 300,000 are eligible for health coverage, so we encourage them to come through. Another, what we're seeing, obviously, is folks that might be losing employment and coverage through their employer. They are also eligible, and that's a normal what we call special enrollment period or a life event, where if someone loses employment health coverage, we refer to it as minimum essential coverage, they are eligible for a special enrollment period and can come in and get help.
We should probably emphasize that, because unfortunately so many people are suddenly, unexpectedly losing jobs, millions of layoffs so far as the economy just sort of stops. So even after your special enrollment, they would still be able to sign up for that.
Absolutely. So for anyone who loses employer-sponsored coverage throughout the year, they're eligible to come in and enroll and get coverage. And of course, if their income has changed, then they may be eligible for Medicaid. They may be eligible for a tax credit, so they could get very affordable insurance. So again, we encourage people to come in, marylandhealthconnection.gov, and see what's available for you.
What's your advice on choosing? Because there are different choices available to people, and there's some complexity there. How do you make a good decision?
Well, most consumers are obviously concerned about the cost of the premium. They're concerned about what they will pay out of pocket. So we do have tools on our website to look and see what are those out-of-pocket costs to be for each plan, what's the deductible. We encourage people to not look only at premium, because especially the way our plans are priced this year, there may be what we refer to as gold plans, which are a little bit more in cost, and it may be $2 more a month, but it could mean the difference in a deductible from, say, a $3,000 deductible down to a $1,000 deductible. So it's very important to look at what the total benefits are. And again, if the website is very interactive and intuitive, but we also have individuals that are available to talk to people by phone that can help.
What percentage of people get help? And I don't know if you can, off the top of your head, tell people what the cutoff is in terms of their income, and their income may be changing. Unfortunately, so how do you even guess?
Correct. It is, well, it's based on what you anticipate your income for the year will be. And so depending on whether you qualify for Medicaid or a commercial health plan assistance, under Medicaid, it's based on the federal poverty level. So for example, for an individual single person, it would be about between $15,000 and $16,000. For a family of four, I believe it's about $35,000. That's to qualify for free health insurance through Medicaid. Now, folks, the range for getting a tax credit is a little different. It goes up to almost $100,000 for a family of four that is eligible for a tax credit. But again, it scales based on an individual's income.
Okay, and before we go, let's just reinforce what's happening right now for anybody who is uninsured or knows somebody who is. Special open enrollment. How does it work? How long do you have?
Till April 15th. And again, just come on in, call or come on site onto our website, use our mobile app and apply. And we will continue to evaluate. This is a pandemic that is just wreaking havoc, as we all know. And so we will evaluate if at some point in time that time needs to be extended. But right now, it's till April 15th, and we encourage everyone to come in and get that peace of mind of some health insurance. We do know that the costs of treating individuals that have COVID is really going to be significant based on if they're required to go into intensive care. So we really want everyone to have that peace of mind if they're able to get insurance, and to remember that there are free and low cost options available.
Michelle Eberle, great to see you. Thank you very much.
And thank you, Jeff. Appreciate it.
With tens of thousands of Marylanders suddenly out of work, there has been a sharp increase in the need for all kinds of assistance, as our Sue Copen found out.
At the Anne Arundel County Food Bank in Crownsville, business is booming, but not in a good way.
We have more food going out right now than we're actually bringing in. And typical donation methods are not able to be utilized at this time due to the pandemic. Our spring food drives have actually canceled because of the pandemic. Pantries are giving out what they would in a month in a week.
Susan Thomas is executive director of the food bank.
When we had the federal furlough, our numbers increased 30 to 50% overnight, and that was one demographic, one group of people.
But she says this could be much worse.
This pandemic affects a larger variety of people all over, especially with all non-essential businesses being closed. So anybody that worked at a retail store or a waitress, we have people that are calling that have actually lost their jobs now. Their businesses are unable to maintain and stay open.
And how they work is impacted by social distancing requirements.
The agencies have lines. We're actually doing drive-through pantries or by appointment only. So we do have limited contacts set up in place for pantries to remain open.
Thomas says this is the worst state of emergency they've ever faced.
Usually we're able to rely on people that can actually donate food, and you can get the items in as you're needing it. This is a unique circumstance where most of the food that we're going to need to get in has to be purchased.
But even as the need continues to grow, Thomas says they'll be there.
Trying to give them more food, just we don't know what's going to happen tomorrow, but we want to make sure everybody has what they need and they're taken care of.
In Crownsville, Sue Copen for MPT News.
Life in every section of Maryland has been affected, as our Nancy Yamada found out.
With gyms closed and people heeding the warnings to stay home, more people appear to be feeling restless and more than happy to enjoy the fresh air outside, albeit within safe distance of others. This is our daily adventure, going on a bike ride with the kids. And in our neighborhood, there's even a scavenger hunt for stuffed bears that people have placed in windows of their home for kids to find. With Maryland schools closed for another 4 weeks, parents, many of whom are still working or teleworking, are settling into this new reality of trying to keep kids learning and occupied.
Taking it day by day. I'll be happy that we have more guidance from the schools next week. Trying to come up with stuff on my own has been a little tough, so.
Yeah, all of a sudden you were thrust into having to homeschool, right?
Yes, and obviously trying to work sometimes. I only work part-time, but on those days it's also been challenging to try to help them all three.
And some parents who were once empty nesters have college kids at home again.
And our youngest son is home. His last semester in college, unfortunately, will be from our basement.
Wow. And so what does that mean? He's a senior.
He would be graduating in May. He did it in 3 years, so I'm really proud of him and all his hard work, and he's not getting to enjoy that last semester of college. He's now they're talking about a virtual graduation and maybe having them come back in the fall, but he's planning to go to grad school, so I don't know if he would even be able to do that.
I'm Nancy Yamada for State Circle.
The coronavirus is especially hazardous for older people who suddenly find themselves isolated, as our Charles Robinson tells us.
We're going to continue our conversations with folks who are dealing with seniors in our community. And today's guest is Laura. She's from Baltimore County, and she deals with a lot of seniors in our community. First of all, let's begin with, is there a lot of anxiety among seniors that are out there?
I think there is. We have our staff all making phone calls to their senior center members or their case managed clients just to kind of give them reassurance. But I think it's just the unknown that has a lot of people questioning what happens next. So we're trying to reassure them, make sure that they understand we're here, they can call us, and that we'll try to do our best to serve them. But it's just a lot of unknown right now, and I think that's what feeds all of our anxieties for any kind of situation.
I noted that you have been out in the community helping to deliver meals. That's a big part of the daily life of seniors, is it not?
It is. I think a lot of people expect that everybody knew this was coming far enough ahead that they could get their groceries and stockpile and be ready for this. But for a lot of people who live week by week on their limited incomes, that's just not an opportunity for them. The money wasn't there to be able to do that. So we're doing our best for those who can't get out and get to the stores or don't have the funds to purchase food to get that delivered to them. So where our county ride would normally be moving people, they're now moving food for us, which is a nice benefit that we have drivers and buses that we can do that. So food is just one of those ways we can reassure people that we're here to help them.
I know in the early part of this virus epidemic, the governor shut down a number of senior facilities. One of the largest ones in Baltimore County is the Charlestown. Tell me what's going on there.
Actually, what he closed were our senior centers, our senior activity centers, and we have 20 of those that we operate in Baltimore County. So where people would normally be coming in every day for activities, classes, mind stimulating classes, and some for a meal, that's no longer happening. So what we're trying to do is reconnect with those people as much as we can virtually, through Facebook, through phone calls to all of the senior center participants, any way that we can encourage them to connect with each other too. So making a phone call, if it's a neighbor, knocking on the door and stepping back and just saying, is everybody okay in your house? But doing the best we can to make sure that people aren't self-isolating during this time, because it can be very lonely and detrimental to your health. So we're doing our best to reach out to people to remind them that you don't have to physically be here to make connections with your friends. So that's pretty much what we're trying to encourage right now. But we do miss them. It's very lonely. I'm one of the few people still working in the building, and it's very quiet and very lonely.
I note that I know you talked about the activities. Tell me what you're doing and how you're reaching out to them. I know that in some communities they're using public access. Others are doing some online activities. Can you talk a little bit more about that?
Yeah, for the most part, we're using our Facebook. Most of our 20 senior centers do have a Facebook that their members can participate in. So we're posting some classes and some activities, physical activities. Our fitness person who runs all of our activity centers from a fitness perspective has been putting out step challenges and encouraging people to still get their walks in and do things like that. But that's pretty much the way we've been able to communicate. We are sending out a newsletter by mail to all of our 20,000 registered senior center participants just to let them know what's going on. But phone calls and email seems to be the one way that we're able to reach most people.
As a wrap up here, what's your message to that community, and what are your hopes for this community during this period?
I think that many of our seniors that we deal with on a day-to-day basis are very resilient. They've been through a lot of different experiences in their history, and this is just one more of those. And so we try to remind them to look to their strengths and to reach out when they need help, but to also know that they are independently a very strong generation of people. And it's okay to ask for help, and it's okay to provide help to other people. So just stay in touch as best you can, and we'll be here when this is all over and hopefully be able to reconnect with everyone. And we'll talk about this in the history books. That's definitely something that we're kind of thinking about. What will we look back on this? And I think that they'll have a lot to share their wisdom from going through this experience.
Thanks a whole lot, Laura. Appreciate it.
Sure.
Charles, thank you. That is State Circle for this week. For all of us at MPT, thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
TV Worth Watching is supported by the members of MPT and by...
What's your next move? Extend beyond your current position or make inroads into a new field through UMBC's professional master's programs and certificates in public policy, organizational psychology, entrepreneurship, and more. Our programs are founded on research principles and led by recognized faculty from government and private enterprise. Our community is committed to seeing our graduates drive positive change and translate policy into action. Claim your future at UMBC.
71 acres in downtown Baltimore devoted to learning, discovery, care, and service. We train the professionals who secure the health, well-being, and just treatment of Maryland citizens. We create the knowledge that cures disease and strengthens communities across the state and around the world. UMB makes the world more just, more enlightened, healthier, and more humane. We are UMB.
Humans are dangerous creatures, but if you keep